A new report from the Montreal Economic Institute reveals a shocking reality. Hundreds of thousands are walking out of emergency rooms untreated every year, frustrated by endless waits in a system that's buckling under pressure. Titled Too Many Canadians Are Leaving Emergency Rooms Untreated, this September 2025 analysis pulls back the curtain on ER access or lack thereof using data from across the country. Let's unpack the findings. Drawing from access to information requests to provincial health authorities, the report covers nearly all of Canada, excluding some data from New Brunswick and Saskatchewan. The numbers are stark. In 2024, out of the 16.3 million ER visits, a whopping 1.27 million patients, that's about 7.78%, or about 1 in every 13, left without seeing a doctor or getting treated.
It's of concern when you've got a population the size of Saskatchewan that's walking out of Canada's ERs untreated. A good part of that has to do with the long wait times. I think it's no secret for Canadians. When you show up at the ER, you know you're in for the long haul. You have 3, 4, sometimes 6 hours, 8 hours to wait before you see a doctor. And unfortunately, the reality is that faced with those times, some people choose to walk out, whether because they have to go pick up the kids or they can't take the time off work, or in some cases where they just think, I can tough it out at home and maybe I'll feel better. Unfortunately, when we look at the data, it shows that people don't actually magically get better when they leave the ER.
Now, provinces vary widely. Ontario fares best at just 4.9%, while Prince Edward Island tops the list at 14.2%. Quebec, with its massive population, clocks in at 11.6%, and out west, Alberta's at 8.8%. But what's even more alarming is that this has worsened over 5 years, up 35% nationally since 2019, with spikes like 94% in Newfoundland and Labrador and 88% in Manitoba. The COVID dip in 2020 is noted, but the trend is clear. ERs are becoming more overwhelmed than ever.
There's a number of factors. But of course, when you compare places like Ontario versus Prince Edward Island, one of the realities you have is just the fact that Ontario is a much more concentrated population. So building one hospital in a city like Toronto can serve a whole lot more people than building one hospital in a town like Summerside, for instance, in Prince Edward Island. So part of that can be explained by this, and there's ratios of physicians and nurses to population. There's a lot of different things that can explain this, but I want to be clear here. Despite the fact some provinces are doing better than others, no province is doing well. So in Ontario, about 1 in 20 patients is leaving the ER untreated. That's up 31% in 5 years.
Digging deeper, patients are triaged using the Canadian Triage Acuity Scale, from P1, which is life-threatening, to P5, which is non-urgent. Half of those leaving untreated are P4 or P5, semi-urgent or minor cases, like stitches or prescription renewals. But that points to a dire shortage of primary care options. In provinces like Manitoba, Quebec, and PEI, this dominates. But in Ontario, Alberta, and Nova Scotia, nearly half are P3 or urgent, with some P2, very urgent, cases bailing 2, up to 13%. Now, overcrowding forces even serious patients to wait, risking deterioration. And the fallout, studies cited show these walkouts lead to worse outcomes, higher chances of returning sicker than you were, complications, or even death. One US study found over half sought follow-up care within 3 weeks, but often for the same issue, wasting resources and straining the system further. So what is the fix? The report calls for bolstering upstream care to ease ER burdens.
One of the things that a lot of people don't know is that about 1 in 10 visit to the emergency room in this country is linked to issues around prescription medication. Now, pharmacists are health experts when it comes to medication, but in a lot of places, we don't allow them to exercise their trade to the full scope of what they've been trained for. It's good that there is an expansion, a gradual expansion in pharmacist-led clinics and nurse practitioner clinics in the country, because whether it is nurse practitioners or pharmacists, they can play a much larger role in our health system in actually treating patients than what than what our health systems allowed them to do for a long time. So every time a new pharmacist-led clinic opens up, well, it can handle some of those cases linked with prescription medication, whether it is in renewing or adjusting a prescription, and that reduces the load on our emergency rooms, that reduces the load on our primary care physicians, and helps them not see more patients, but helps them see patients that have a healthcare need that's more that they alone can fulfill, versus some healthcare needs that can be fulfilled by other health professionals, such as nurse practitioners and pharmacists.
Nurse practitioner clinics, proven in Quebec and Ontario, can handle diagnoses, tests, and prescriptions. Other provinces like BC and Alberta are piloting those initiatives. Pharmacist-led clinics, pioneered in Alberta, expand roles for minor ailments. And minor emergency centers, inspired by France's independent models, could siphon off non-critical cases with specialized setups, free from bureaucratic red tape.
If nothing changes, it's clear that this trend is not going to get any better. Canada has an aging population that comes with its own challenges in terms of healthcare. That means that we have more healthcare needs. It's clear that even in the way that it's built right now, our health system is failing. Is failing way too many Canadians. Just at the emergency room, the fact that nearly 1.2 million, nearly 1.3 million people walked out of emergency rooms untreated. That's a population the size of Saskatchewan that our health system is failing at delivering services to. There's other cases that we can talk about with people not getting the surgeries they need in a timely manner, people that don't have access to a regular health professional, such as a family doctor. So if nothing changes, I fear that this is only going to get worse. And unfortunately, some people are going to fall through the cracks and suffer from it as a consequence, whether it is with permanent injuries or, unfortunately, in some cases, death.
In the end, this isn't just stats. It's Canadians in need, denied timely care. By addressing primary care access gaps, we can cut wait times, prevent walkouts, and save lives and dollars. Back to you.